Yeah, 7. Uh-huh. Uh-huh. Fitting. Fitting sock. We finished with fitting guide. This one, correct? Can you see it?
Yes po,
Is
Doc.
this correct? Okay. All right. So this is the primary gaze. So when you check your patient, just always remember there's the primary gaze, meaning to say that's by looking straight. Okay, that's your primary gaze. So you have your secondary, you have your lateral gaze position. So looking, whether it be dextro version or levo version, that's your lateral gaze position. Correct? Joyce, still good? Am I still clear?
Yes po, Doc.
Okay. Uh, is my reception good enough? Is it clear? Is it clear enough?
Napuputol lang po ng konti, Doc, paminsan-minsan po.
Okay, okay, okay. But you can hear me now. That's why I need you, Joyce, to let me know if you can hear me or not. Yeah?
Yes po, Doc, narinig naman po.
Okay, good, good. So observe decentration or lag. So how do you observe decentration? From the word, it's not centered, right? So from the primary gaze, you are to have an allowance. Zero point 0.2 to zero point 0.7 is acceptable. So meaning to say, if looking at this, so primary gaze, you can have a zero point 0.2 to zero point 0.7 millimeter acceptable decentration, meaning to say, usually it's decentered. You can see my, there you go. All right. So if this is the cornea and this is the contact lens, a little decentration is accepted as long as it's zero point 0.2 to zero point 0.7 millimeters, correct? Looking straight. Can you hear me? Can you still hear me?
Yes, Doc.
Okay, thank you, Zach. Thank you very much. So am I clear, Zach?
Okay naman po. Clear naman.
Okay, so you understand that from the primary gaze, right? Acceptable. Up gaze, you have 1.5 together with lateral movement. So meaning to say, if this is the eye and the patient is looking, this is looking nasally. So if I have a decentration of 1.5 millimeter, this is accepted. But if it's already 2 millimeter, this is not accepted. Clear? Zach?
Yes po, Doc.
Okay, same goes with, as you can see here, up gaze, where in looking, if I am now looking up, okay, and there is a decentration when you look up over here, let me clear it for you. So there you go. If the patient is looking up and there's a decentration of about 1.5 millimeter, this is acceptable. If this is beyond 1.5, let's say 2 millimeter, then this is not acceptable. Are we clear so far?
Yes, Doc.
Okay, so we're good with observation of decentration, which you will do this Saturday, correct? You will see all of these this Saturday. Next, for the centration, of course, often is centered up, sometimes up and out. So it's okay. It's acceptable as long as it's point. Remember, if primary gaze, point 2 to point 7 is good. Looking up, 1.5. Looking laterally, also 1.5 millimeter is acceptable. So you look at the shape, whether there's warpage. If there's warpage, then that's a problem. Posterior film should be uniform. Not much of a problem when it comes to soft contact lens because it conforms to the shape of the cornea. Correct? Zach? Correct? Can someone confirm if you can still hear me?
Correct po, Doc.
Okay, Joyce. Thank you. So far clear.
Clear po, Doc.
Thank you very much, Joyce. Okay, now, as you can see, mechanical prevention of corneal trauma, limbal trauma, conjunctival trauma. Those are the things that you want to prevent. Of course, we don't. Who wants trauma? No one, right? So what you want is comfort at all times, correct? And then, um, for physiological, no corneal exposure, no corneal desiccation. Desiccation means there's dryness that can cause problem to the anterior topography or to the anterior ocular surface. So you don't want that to happen. Tear film disturbance and then eye wettability. Okay, about 1 millimeter symmetrical overlap is ideal. What does that mean? There is what you call if I am if this is your cornea, there's an overlap. This is the overlap. So this the broken line is your contact lens. Now there is an allowed overlap. Okay, as long as primary gaze is zero point 0.2 to zero point 0.7. Correct? Still good millimeters. Okay, and then as ideally you want that equal, equal, equal corneoscleral, corneoscleral overlap. So there's a corneoscleral overlap. So you want that equal. If it's not equal, then for example like this, and then this one is over here. So this is what you call unequal corneoscleral overlap. And whenever you have this is most likely not acceptable, especially if it's beyond zero point 0.7, right? Because what's accepted is zero point 0.2 to zero point 0.7. So if it's beyond 7, zero point 0.7, such as zero point 0.8, zero point 0.9, or even 10, then it's not going to be acceptable. Okay? Joyce, are we still clear?
Yes po, Doc. Thank you po.
Okay, thank you. Um, for soft lens fading effect on a blink, too steep, we don't want that. Vision is clear every blink. Why is that? Because when your fitting is steep, if this is the cornea and this is your contact lens, every time you blink because of the eyelid, it will push that every time it blinks. It will push that towards the cornea, correct? So every single time you blink, it will push it down. So automatically you see clear every after blink. So every after blink, the vision clears out. To compare with too flat, it's the reverse. So if it's too flat, as you can see, it moves a lot. So every time you blink, it will move. So it will blur out every single time you blink, which is the reverse of too steep. Any questions on that?
No, Doc.
Very good. Thank you. So this is too steep. After that, as you can see, as you blink, it moves closer to the cornea, correct? That's why it clears out. This is too flat. So before blinking, it's good, but as you blink, it will move. That's why it will blur out. So far, we're good. So movement, we have softness. Can you still hear me? Can can you still hear me?
Rinig naman po, Doc.
Okay. So removes and disperse ocular debris. So why do you need movement? You need the contact lens to be moving all times. You cannot be too steep. We don't want too steep. We want it to move. We don't want excessive movement, but we need it to move. And the reason why we need to move, because every time you move or the contact lens is moving, it removes ocular debris. It also promotes tear exchange and possibly aids in epithelial wetting by the mucin spreading and smoothing. Are we clear so far? Can you still hear me?
Yes po, Doc.
Yes.
Thank you, thank you, thank you, thank you. Clear so far, Zach, Joyce?
Apo, Doc.
Okay, no questions on this.
Wala naman
No
po, Doc.
questions. All right. So soft lens fitting. So lens movement depends on one, lens type, which is what type of contact lens are you using. The lens design as in monocurve, bicurve, tricurve, or is it a back surface or a front surface? So physical properties of the lens, of course, the material, especially the rigidity factor, such as hydrogel against silicone hydrogel. So rigidity wise, it's more rigid when it's silicone hydrogel over hydrogel. Fitting relationship, of course. Lid factor, the tighter the lid, the greater the torque, the greater the relation of cornea to lid contact lens relationship, right? And then, of course, you also have your anterior eye topography. Any questions on this?
None po, Doc.
Thank you very much. Ina, thank you so much. Thank you. Um, Soft lens fitting assessment of mobility. Every time it moves, movement on blink. So every time you do movement on blink, you also have to assess. Okay. Then lag following the eye movement. So if I am looking to the left or to the right, okay, for example, I would look to the left, okay? So the eye looked here to the left, therefore the cornea is here, but the contact lens is left behind. This is what you call lag. Are we clear? Are we clear?
Yes
Anyone?
po.
Thank you, Ina. So either here or here. If the contact lens is not following, this is what you call lag. Even looking up, assuming this is your cornea now, and the contact lens is left behind, that's what you call lag. Are we clear with the lag? Okay, so you have movement up gaze, and then what you do is the lower lid push up test. How does that work? It's like this. So if you are looking up, and this is the lower lid, so what you do is with your thumb, push it up, push it up, and that would touch the contact lens. And you are to check whether if it's too tight, you would notice it's not moving much. But if it's loose, it moves a lot. It moves fast. So it's either no movement, slow, or fast. Clear so far?
Yes po.
Okay, good. Next. So you have your assessment precaution. If conjunctiva is loose, then there is possibility of indentation. What is indentation? Indentation is like, do you know, like a suction, that when you use a suction, it leaves a mark? Have you tried? I don't know if you have that, like the one you put in the car, you stick it on the window or the glass, and it sucks. Have you done that to your face? So when you do it to your face, when I was young, I used to do that. When I stick it to my face, it leaves a mark. That mark is called indentation. Are you clear with indentation?
Yes, Doc.
Okay, Zach, thank you. That's indentation. So loose conjunctiva flexes with lens giving false impression of the lens movement. None may be present. Loose conjunctiva may decrease lens movement by enveloping the lens edge. So this is how it looks like. So you can see there is loose conjunctiva. It creates that dent or a marking. Okay. So this is your, this is an example of a gaze lag. So you can see, where is the lag? Inferiorly, superiorly, nasally, temporally. Where's the lag?
Inferior po, Doc.
Inferiorly, very good. Inferiorly. What made you say that? Because you can see majority of the contact lens is inferiorly located, while superiorly you can see the edge of the contact lens already, right? Okay.
Yes
Next,
po,
this
Doc.
one, up gaze. You can see that it followed. This is more likely to be, okay. All right. So, anyways, up gaze. As you can see here, this is relatively tight. Correct? Correct. Why is it relatively tight? As you can see, that's, it is not creating that excessive lag inferiorly, even though you are already looking up. So this tight is fit, is steep rather. Okay. So this is loose. Why? You can see this is unacceptable. Correct? Why is it unacceptable? Anyone?
More than
It's beyond,
1.5 millimeters.
because it is beyond
Beyond point
1.5
two.
mm.
1.5. Remember when looking up, 1.5 is our acceptable lag. So this is beyond 1.5, correct?
Yes, Doc.
Okay, gotcha. And then this is lateral lag. Is this acceptable or not?
Parang hindi po, Doc.
Correct. Why?
Because it looks more than 1.5.
Correct. This is beyond 1.5. So that's how you assess. Very good, Zach. Very good. You see it right away. This is beyond 1.5. So basically, this is how you would assess this Saturday. Anyways, I'm flying back by Saturday, so I'm already back in Manila by then. And then this is what they call the push-up method. So this is by pushing the contact lens against the cornea using the lower lid, looking at the movement of the contact lens. So if you are moving your contact lens, looking at the behavior of the lens, whether it's moving fast or loosely or not moving at all, meaning to say it's steep, right? Correct? So far, so good.
Yes, Doc.
All right, all right. There is also this ranking assessment method, the lower lid push-up test, which I have shown you, the post-blink movement. So what you ask is dynamic. There's two things, by the way. You have a dynamic fitting, dynamic against static. What's the difference? Dynamic fitting and static fitting. Can anyone explain what's the difference? Is there a difference? Wait, son of a bitch. Oh, okay. PWD, right? Ah, there's my wallet. Uh, yeah, yeah. There's, she's coming. Okay. Okay. Guys, can you hear me?
Yes, Doc.
Sorry, guys. Let's end here. I'm boarding already. Thank you very much. Take care, guys. Stay safe. Bye bye.
Thank you,
Thank you
Doc.
po,
Thank you,
Doc.
thank
Ingat
you, thank you,
po.
thank you, thank you.
Thank you
Bye.
Thank you
po.
po.
Bye bye. Thank you. Bye bye.
Thank you po, Doc. Ingat
Ingat
po.
po.
Thank you, thank you, thank
Ingat
you,
Safe
po.
life po,
thank you.
Doc.
Yes, thank you,
Take
thank
care
you.
po, Doc.
Thank you, guys. Thank you. Gotcha. Oh, God.
Ingat, Doc.